Good evening and welcome to yet another learning session with Digital Excellence Pharma Academy. And today we are going to look at patient centricity and what it is to go beyond the buzzword and to actually do patient centered marketing. So, this is probably the first time that we all have, in one way or the other, become patients or patients' relatives. Thanks to the COVID 19 epidemic, many of us have either have suffered from COVID or have relatives and friends go through the trauma of COVID 19 or just read the news every day about how there is a new outbreak, a fresh spike in the incidence of COVID. And this is one time when even the pharma professionals are concerned, sometimes even worried about the efficacy of vaccines, about the right interval between the first dose and the second dose, and which vaccine is more efficacious, and should they take it now or should they wait on? And there are so many questions for which there seem to be no answers. And this is exactly how the patients feel in their encounter with many of the illnesses that they suffer from. So it's very important at this point for pharma professionals to really understand about patient centricity. And we at Digital Excellence Pharma Academy have done so far 4 webinars and question answer sessions with experts in the field of patient centricity. And today we will take a quick look at one of them. And over the next few Saturdays, we will revisit those because repetition is the key to learning. Because when you repeat a couple of things, first times it's just on your mind and then it slowly slips away. But when you repeat it over a couple of times, it slips from your conscious mind to your subconscious mind and influences your understanding as well as your decision making. So, for the next 10 minutes only, a quick introduction into what it is to be patient centered and how can pharma use patient centricity as a go to market model, or as Sanjeev Navangul says, go to patient model.
Let's talk about patient centricity and patient engagement. As I had conversations with pharma and I explored the healthcare space more and more, the thing that struck me was that the patient who should be at the center of healthcare was not at the center of healthcare. They were expected to be passive recipients of medicines or care. And the more I looked at it, I found that as you go into chronic conditions, which are long term and they are very different from kind of the early sicknesses that people go through of acute medicine, you find that lifestyle plays a big role, other elements of care play a big role, and all of those happen outside the clinical arena. And that's when I kind of started feeling that it was important for patients or their families to be informed and for them to be able to make decisions that improve their quality of life.
What is it that pharma leaders can do to regain trust and confidence of patients and maybe even improve the overall public opinion about pharma?
Yeah, so it's something that often kind of amazes me that pharma creates products that save lives for patients,
Right.
but the level of trust and or the level of distrust itself is so high that it's in some sense fascinating to see why that happens. It's important for everyone in the healthcare industry to think like the patient. To some extent, COVID kind of helped the healthcare industry seen themselves as being vulnerable as well.
So, this is a very important statement that you made that for chronic diseases, 95% of the care happens outside the clinic area. So, what can pharma do to create value for patients with chronic diseases?
Yeah, so I think this is really the crux of it, because even now, a large part of pharma's efforts are directed towards the doctor or supporting the doctor in prescribing the right medication, which is an important part. But you have to realize that for chronic conditions, most of them are lifestyle diseases as well. So apart from your 3-minute consultation, or at best 10-minute consultation once in 2 months or 3 months, the rest of the time they're on their own. But also, we have to recognize that not all patients are exactly the same. Not everyone will want the same thing. While there'll be some who'll want more information, there'll be others who'll want just give me the bare minimum. There'll be others who'll want to look at the research behind something. For some reason, there is no segmentation of the patients themselves. So, why not look at the needs of different patients and create solutions? So, for instance, the simple thing again, and especially in an Indian context, is that patients do not get the amount of information they could get from a doctor given the duration of a consultation, and even the additional supporting information. If you look at most other developed markets, the amount of consultation is, or the duration is, I think the average is supposed to be some 11 minutes, but in India, the average is, I think, 1 minute or 1.5 minutes. So obviously, the doctor cannot provide information to the patients, and patients go back home and have a ton of questions. That's really one of the easiest ways where pharma can step in and provide value to patients.
Wonderful. So sometimes pharma complains that the reps don't get time, but I pointed out to them, as you mentioned right now, that even the patient gets just about 10 minutes time. So it's rather difficult for a doctor to give some time to the pharma reps, whose number has only increased now. So I think engaging the patient, empowering the patient is the fulcrum around which pharma and physicians both need to work together so
Correct.
that their information needs are addressed. I really liked some of the slides that you shared, like the challenges faced by the patients, and you have so well captured them. And especially if it is a overwhelming diagnosis, even if it is a small thing like diabetes, suddenly a person comes to know at 35 he's diabetes. I mean, I agree with you that the first feeling is getting overwhelmed, and I think an empathy with this challenges faced by the patients is so important. So
Mm.
it's wonderful that you captured this. Can you throw some more light on this as to how pharma can understand better the challenges faced by the patient, and then begin patient social prescribing or patient support groups, and working with the organizations like PatientsEngage to address this huge challenge faced by the patients?
Yeah, so I think as soon as that diagnosis happens, as far as the healthcare sector is concerned, they are seeing dollars. They are seeing lifetime value of this patient. They are seeing this patient is there for life. And for the longest time, the line that has been used is once a diabetic patient, always a diabetic patient, right? And I think it's important to recognize that there have been over time incidents and now more and more research which shows that it's not the case as well, right? So I think it's important to let patients know that if they work towards it, except excluding type 1, but if you're type 2, for instance, if you work really hard, you can reduce your dependence on medication. You may even be able to get off medication. And I think that hope is important. It's something that is contrary to pharma, and maybe they don't see their role in this. But I think even otherwise, right, ensuring that patients have access to the right information, ensuring that they can be put in touch with other people dealing with that condition so that they can learn from them, ensuring that they have access to a place who will answer their questions without judging them. So
Right.
when somebody says, will having, I don't know, jackfruit reduce my diabetes, for instance, or will having can I have mango? The medical professional, they don't have the time, and most of them will kind of dismiss, you're looking up too much online, forget that, you want to follow Dr. Google or you want to follow us. It's not binary. And that's where I think pharma needs to understand the different segments of people and also understand them a bit more. I think we all need to listen to the patients to understand really the different personas. I think we talked about everybody is not the same. There are some who want to quietly follow the doctor, and so long as they trust the doctor, they just want to go ahead and do that. There are others who want to supplement, and I think we need to treat different groups of patients and their families differently. We also need to realize that sometimes it will not be the patient who can ask these questions, it will be the family member who will ask. So I think it's important, and pharma, we are happy to work with pharma on this, but let them work with us to understand what the patients want. It's not going to be an overnight answer. There are no ready-made solutions for this. And you can't just take the Western model, because what works there doesn't work here, which is one of the reasons we set up Patients Engage, is that if you look up online in the forums, the discussions don't make sense to people in India. When they talk of a care model of, assisted living and all of that, it just doesn't work for us here. So I think it's important for pharma to really, really understand and figure out, and even digital, right? One of the things, so pharma is doing a lot of work to help the doctors attend online sessions and so on. Maybe a little bit of effort to help train patients to understand telemedicine and what are the models
Right.
that they can, for instance. So, and we can come up with a whole bunch of things, but I think we'll have to go into each one separate, and each disease area is different.
Right, it's wonderful, Aparna, talking to you, and it was a huge learning session. And I think you bring definite value to pharma's proposition of improving the lifestyle, helping them with the information. So I look forward to one more session with you sometime in the future where you can tell us that how actually pharma can use, especially the digital media. Salil Kalyanpur talked about how the tech companies look at the population base of engaging 200 million people. I mean, that's possible now. You can engage specific segments of people. Maybe
Correct.
even when it comes to diabetes, a small segment of even the pre-diabetic segment, where probably the what you talked about reversal is much more easier, and then it's so important in building trust. So thank you so much. I really look forward to another session with you sometime in the near future.